One of the big problems with IVF in India today is true for all of healthcare, and that is that healthcare is being treated as a business. There used to be a time when doctors were respected professionals when they did what was right for the patient because they felt they had a fiduciary responsibility to the patient. Doctors cared about their reputation and they knew that the better the care they took of the patient, the better the patient would talk about them to other patients. And this is how their reputation grew, what is called word of mouth. Tragically, a lot of that has changed. Very few doctors can even afford to set up independent practice. Very few doctors can afford to set up their own independent IVF clinic. As a result of which, most will end up getting employed by corporate hospitals or corporate chains of commercial IVF clinics. And there, the equation is completely different because there, the doctor is not incentivized in order to provide the best possible medical care to the patient. The doctor there is incentivized to maximize his personal salary, and his salary is going to depend on how many IVF cycles he does, which means actually there is now an antagonistic relationship. So that often the doctor is not telling you what's in your best interests, he's telling you what's in his best interest because he gets a salary from the corporate headquarters or from his boss or from his business manager who sets revenue targets and said this is the number of IVF clinics. And part of the problem is a lot of these clinicians live in their little silos and just obey orders and follow cookbook protocols because that's what they're ordered to do and they don't have any freedom to step outside that. And part of the problem is they don't know enough about what goes on in the lab. There is so much misreporting going on in these labs of these IVF clinics. The doctors are completely clueless. The laboratory technicians and embryologists are completely clueless. As a result of which, obviously, patients are completely clueless and patients get taken for a ride left, right, and center. And I think the tragedy is that the number of clinics which is increasing, which are being run by these commercial chains, is increasing so much that honestly, I don't think anyone's going to trust any IVF doctor anymore in the future because so many of them are being taken for a ride.